In this video, we're going to discuss ultrasound terminology in biosafety. Starting off with ultrasound terminology speaks in reference to echoes, or sound waves that have been reflected back. And there's four main terms we're going to look at. The first one is anechoic. The next one is hypoechoic, hyperechoic, and isoechoic. Now, as you can imagine, anechoic means without, prefix an, echoes. So if there are no returning echoes, the ultrasound machine is going to display this as black. Whereas hypo, hyper, and isoechoic are all relative terms. Hypo, less than, echoes. So while this is a relative term, some use it as an absolute term, meaning darker or low-level grays. But technically, it is a relative term, meaning one tissue is darker or hypoechoic in reference to another tissue. In the same way, hyperechoic means more than echoes, or brighter. And again, while this technically is a relative term, it may be used as an absolute term for brighter level grays or brighter echoes. In the last term, in the same vein, isoechoic. This means the same level of echoes from one tissue to another. To illustrate this ultrasound terminology, let's look at the ultrasound image on the left. And just to orient you, this is a right upper quadrant abdominal view. And here we see the outline of the liver, and then here we see the outline of the right kidney. And in between those two, you see some free fluid in Morrison's pouch. Now, that free fluid is anechoic. It's black. And if we compare the right kidney parenchyma, or the tissue, in comparison to the liver parenchyma, that tissue is hypoechoic compared to the liver. And conversely, the liver tissue is hyperechoic in comparison to the renal parenchyma. And if we compare one area of the liver to another, they are isoechoic to each other or the same. Now for ultrasound biosafety in the ALARA principle. So what does ALARA stand for? Well, it stands for as low as reasonably achievable. And what does that mean? Well, in vitro studies have shown that cellular damage can be caused by ultrasound waves. Microcavitation and heat production occurs with high-intensity beams, but with the intensities that we're using today, no adverse effects in human tissue have ever been demonstrated after decades of use. However, because of the theoretical possibility, we want to follow the principle of ALARA, or as low as reasonably achievable power. So this predominantly has to do with two components of ultrasound. Number one is power, and power is how intense the ultrasound beam is being sent out from the machine, or in other words, how loud the machine is yelling, if you will. The second is time. So the length of time you are scanning the patient. If you can limit the power and limit the time, then you're using the ALARA principle. And this predominantly is important in two modalities. In first trimester pregnancy, and the second one would be in ocular scanning. And the reason being is because at this time you have very small fluid-filled structures that you're scanning, and especially in the setting of first trimester pregnancy and the possibility of damage, you want to limit power and time of scanning. This can also apply in training programs where you're using live models to train. You want to limit the time that you're scanning and taking breaks in between scanning for these model patients. So let's all follow the ALARA principle. To end our discussion of ultrasound biosafety, I want to mention a few brief principles on how to care and maintain the ultrasound machine, as well as cleanse and disinfect the ultrasound transducers. Firstly, if you're using the ultrasound machine for patient care, you need to use personal protective equipment as clinically indicated. You also want to inspect the equipment before use for any signs of damage to the transducer or cable, such as a crack or a break You then want to make sure that the ultrasound machine has been cleansed and disinfected before and after patient care. There is low-level and high-level disinfection. There's also pathogen-specific disinfection, and you'll want to follow both your vendor-specific as well as departmental-specific guidelines for cleansing and disinfecting. And lastly, use common sense when caring for and maintaining the ultrasound equipment so that you can use it in longevity to care for patients.